Welcome to the American Academy of Emergency Medicine's Justice, Equity, Diversity, and Inclusion section webinar, Being Latina in the Emergency Medicine Workforce. My name is Kristen Fontes. My pronouns are she, her, and I will be your moderator for tonight's discussion. For anyone that is joining us as an audience member, please feel free to use the chat function to say hello, introduce yourselves to us, tell us where you're logging in from. It's also a place where you can ask questions, and I will be watching the chat and I will try to incorporate any questions that I can from our audience members throughout the discussion. Now here in these webinars, we really do intend to create and foster a very open and respectful dialogue. This is a safe space, but because we are talking about issues that affect folks from minoritized and marginalized groups, occasionally there may be things that come up that could be triggering or upsetting for some. So if you find yourself in that position, please know that we want you to take care of yourself, even if that means stepping away from the conversation. We really do want to prioritize everyone's well-being here, okay? So without further ado, we will go ahead and move on to introducing our panelists. We have a great group of folks that are joining us tonight. So panelists, you can go ahead and come on screen, and then we'll just have everyone just give you a little bit of background on yourselves, and then once we do that, we'll move into the discussion. All right, so why don't we start with Dr. David Leone.
Hello. So I'm senior resident at Hopkins, July 5 of 6 years, so I'm but almost there. My pronouns are he, his, and my heritage, mi padre cubano, my mom's Spanish, and unfortunately, because of the restrictions and getting to Cuba, I ended up having a Spanish passport, not a Cuban passport. But it's always been, Latino has always been a huge part of mine, especially growing up, but especially when going to medical school, which was in Vermont, which was much more homogenous than DC and my upbringing. So if anyone has questions that are in med schools in the Northeast in particular, especially in the hinterlands of the Northeast, I'm happy to speak about that. But I'll popcorn to the next person I see on my screen. I believe that's Jessica Munoz.
Hi, everyone. I'm Jessica. I am a second-year emergency resident at Loma Linda, and I grew up in Chicago. Both of my parents are Spanish-speaking only, so I used to go with them and interpret for them at doctors' offices, and I think that kind of sparked my interest in medicine. And then I went to medical school at Ohio State. I was involved with being the president of the Latino Medical Student Association there, and we brought up a lot of attention to just improving the treatment of patients at health at detention centers, so advocating for immigrant population as well as those that are currently incarcerated. We started a book club with them. And so I'm a big advocate about anything that has to do with social justice. And I felt like emergency medicine was really my path into all of these avenues. So, and I'm in California now. So if anyone has any questions about any of those states, I'm happy to talk about that.
Awesome, thank you. We'll move on to Dr. Sophia Simic.
Sure. Hi, my name is Sophia Simic. I am also an emergency physician. I am originally from Lima, Peru, but grew up kind of all over, moved around a lot. I lived in Venezuela and I lived mostly in Puerto Rico. That's where I went to high school, college, and then medical school, and then moved to the Bronx in 2014, till 2018 to do residency at Jacobi. In the Bronx, and then I stayed on as an attending for the last 4.5 years, and recently just decided to take a bit of a sabbatical and look at international projects. But
awesome, thank you so much. We are still waiting on Dr. Elaine Rodriguez. She is running a few minutes behind, so we'll just bring her in whenever she gets here. So I think what we can do at this point is start having a bit of a discussion.
Actually, Elaine is on. She joined.
Oh, yeah. Oh, okay. Oh, there. I'm sorry.
It's
Let's
okay.
have Dr. Elaine Rodriguez introduce herself. I was like, your name said AEM. Go ahead.
Hi, so my name is Elaine Rodriguez. I'm actually from the Bronx, but I was raised in the Dominican Republic. Went to medical school in Syracuse, residency also at Jacobi in the Bronx. And now I'm an attending physician at Staten Island, as well as the director of community affairs for our department. So I'm excited to be here.
Great, thank you. Welcome everyone, and welcome to the folks in the audience. So each of our panelists was asked to submit a few questions that they would want to be asked to talk about things that they're passionate about and to help us really frame our discussion. So I'll be using those to sort of structure the majority of the discussion. But like I said before, if there's any questions from participants, feel free to use the chat box and we'll try to get those incorporated as well. So I think I would love to start with Jessica. I would love to know, and I'm sure we all would too, what's your favorite part about being a Latina in the ED?
I mean, I will say that it's being able to just talk to my patients in Spanish. So I think that not a lot of people actually speak Spanish here at the hospital where I work at. And so I love being able to walk into a room and like having like a young kid on the peds side look at me and be like, oh my gosh, is this really my doctor? I'm like, yeah, we look the same, right? So I feel like that's really exciting. And then also incorporating like the cultural aspects of, using like Vaporu and things like that. Like I get that, I've done that. I grew up doing those things. So I would say those are probably some of my favorite things, but also just like understanding what it is to like grow up with not a lot of money and not having access to healthcare, because I experienced that firsthand. And so now I get to like figure out, okay, how am I going to help my patient? How can I advocate for them?
Okay, thank you. Any other panelists that want to answer that question or comment?
I think that the being able to communicate with your patients in their language is really important, because especially when you work with elderly populations, they're much more prone that when you speak to them in their own language without a translator, or even they're much more prone to giving you an actual very detailed history and getting a more thorough like HPI. And I think that's really, really something that I love doing that as well. Just being able to communicate and getting information that maybe somebody else won't get if you use a translator or if you use a family member as a translator.
I can't agree more with those things. There's definitely items like the degree of history you can get that's much more accurate and much more elucidating and can really alter the management of a patient's course entirely when they feel much more comfortable giving you a full story rather than be like, oh, it just hurts here a little bit. And then when you actually speak them in Spanish, they open up much more and reveal how long it's been going on, a true timeline. And I would say this is a little bit because of the dual hats I wear, but when I'm on OB for OB anesthesia, there's, I have some people coming in that decline epidural because someone went in, they're like, oh, she doesn't want epidural. And then I go in and I talk to them and I explain to them what an epidural is, and they feel they're like, oh, that sounds much better. So, and it ends up being a much more comfortable spot for them for what could have otherwise been a 19, 20-hour first child.
Great, thank you all. I think that's a good place to transition to our next question, which Sophia had submitted, which is how has your background shaped the way that you approach patients? I know everyone mentioned certainly language is something that can be extremely helpful and also really like a way to really connect with people and kind of understand them on a deeper level. But let's talk more about, how your background also, how other things that sort of shape the way that you approach patients and things that might be unique based on your identity.
Sure. I think one of the things that that I really enjoyed in the ER was being able to communicate. Obviously, language barriers, I think, were really, really important in being able to overcome them, but also kind of having a shared experience of being an immigrant with your patients, having similar stories, or having, grandparents that have gone through similar things, parents that have gone through similar things, siblings. I think that shared experience is very important. And what was the other thing? I was going to say something else. I'm totally blanked. Sorry, I'll come back to it.
All good, all good. Other thoughts on this question?
I would say
Oh,
definitely just being like not judgmental about so many things that happen in the emergency room. Like I'm like, I could totally see my dad like not showing up when he like really hurt himself. And sometimes I hear other providers saying like, why did they like they get upset or even angry that, you know, people take so long to show up. And it's like, I mean, I get it. I get why they didn't come. There's so many factors that I know probably went into this. And then it's easier for me to talk to my patients about those issues. Sometimes they don't even have to say it and I can kind of tell, you know. And so I feel like that kind of gives us like an extra like I think that's what David was talking about, like just like they trust you, they give you more information because you look like them, you speak their language, and you're like understanding where they're coming from. And I feel like that makes such a difference.
Oh, I kind of remembered. The third thing I was going to say is, sorry, it was having lived in so many different Latin American countries, it's understanding the healthcare there compared to here, and kind of like patients' expectations versus, you know, what they don't understand at all. Like even a lot of our patients don't understand the healthcare system here, and helping them navigate that system, having worked for, you know, I did all my medical school and spend a lot of time in the Puerto Rican healthcare system, which is, you'd think similar, but it's extremely, extremely different. And helping them navigate that, I think that's really something that's really, really important. Not just, you know, you can speak the language, but if you know the culture and you know how the healthcare system is in different countries, that can be a huge attribute to your patients.
Yeah,
I would say one. Oh, go ahead.
No, David, go ahead.
I was gonna say one little interesting thing for like background is too is from the part of Spain that my mom's from, it's very rural, and you know there wasn't really much primary care available there. Primary care was pretty much, you know, a lot of homeopathic remedies. And so when people talk about like, oh, you know, I didn't go to the store to get like pain medication. I had a tinta at home that I used. And so I think most providers without kind of a background, especially coming from areas that don't really have access to care that a lot of other folks have, might not understand what I think that is, or more homeopathic remedies is. But you know, having that background helped identify like, oh, they might have been treating something that might have actually been making this illness worse.
I was just going to add that like the other day in the emergency room, someone was like, oh my gosh, I can't believe this person came to the ED for this. And I'm like, you know, in Mexico, a lot of times, like you just show up when you're sick to the, like whatever doctor you can get to. Like primary care isn't really a thing in some of these countries. And so I think that also adds like the fact that you're able to like educate some of these providers about how different things are in other countries. Like these people aren't ignorant. These people aren't like stupid. Like these people just come from a different country where things are done differently. So like we should be more open and understanding to these instances. So I feel like that's something else that's really cool about being, you know, Latino in medicine in general. It's like, hey, actually, like let's have a conversation about what you just said and kind of bring it back to like where it stems from.
Great, thank you, everyone. Elaine, did you have something to add earlier?
I think everyone touched like basically said what I was gonna say about like just cultural awareness. So I agree and I concur.
Excellent. Well, I do have a question that you submitted, Elaine, which I wanted to go to next, which is, we often speak about the hardships and struggles that one faces of sort of not fitting into like the status quo of what a doctor should look like. But do you think there is an advantage to being sort of like a outsider or someone who is different?
It's funny because when I submitted that question, you know, I feel like every day at least, and maybe I'm being dramatic, but it's funny because patients are usually like, well, you know, who's the doctor? And I feel like I'm always like, me, like I'm the one, it's me, I'm the doctor. I think that sometimes, you know, it does create frustration, right? Because here you are, like after 20 years, all this debt, and like you don't fit the type, right? You're not like a cisgender white male. But I think that, you know, there is advantage to being not the prototype, right? Like you have a different perspective that some people don't have. And I think it goes with culture. You know, being a Latina woman, it's different. You see things that perhaps somebody else doesn't see in your counterpart, and it happens multiple times. And even it's funny because like the other day I was talking to one of my colleagues, and he saw the patient first, and then I saw the patient, and the stories were very different. And you know, I told him, I was like, well, maybe it's just because of the way I look. Right. She was a Latina female, and she did say things that were completely different from what he heard. But I think that, you know, she just didn't want to express these feelings to somebody that maybe to her didn't kind of understand where she was coming from. So, you know, I was like, well, there's some advantage to not looking like him. Right. And he was a cisgender white male. So then that's kind of like where the question came, like, you know, you bring a different perspective and like a fresh outlook to medicine, right? Because the house of medicine is pretty stagnant in their ways, which can be good, but a lot of times can be bad.
Thank you. Other thoughts on that question? Okay, why don't we move on? So Jessica, you had also submitted a question about, you know, what some of the challenges are that you have faced being a Latina physician. I know Elaine kind of mentioned, you know, one type of challenge in terms of, you know, people's biases based on the person that they're looking at and sort of the way that they categorize you by race and gender and other factors. But if anyone in this group feels comfortable sharing some of the challenges, I think that would be helpful for our audience as well.
Yeah, I would say this kind of goes back to like kind of being that kind of the outlier a little bit, is like being able to relate to people who are either struggling with the MCAT because they didn't have, you know, money to pay for a course like I did, you know, going through medical school and not having parents who understand how the system works, let alone medical school works. So like being that first person to have to go through everything on your own essentially. And now you see like, you know, I'm able to work with like LMSA and SNMA and like be the mentor for those people and be like, hey, like I also didn't have, you know, physician parents and I still made it, you know, and like I had to retake the MCAT multiple times, and you know, I had to figure it out the hard way, but then I learned how to do better on like step 1 and all the other board exams that come after that. But I think it's really hard in medicine to find people that struggle, like because most people are very type A and don't like to share their struggles. But I feel like I'm very, very open, and I don't know if that's just because of a cultural thing, but I'm always like open to share like, hey, I took the MCAT multiple times, like it's okay. And then I have a lot of med students that, you know, share things with me that they haven't shared with other people. And I feel like that's, I don't know, it's awesome to be able to have that relationship with other people because of the struggles that I went through.
I agree. I had when I moved to New York, it was the first time that I lived in like the continental US, if you don't obviously include Puerto Rico, and I had gone to medical school in Spanish. So I think the like imposter syndrome is very big sometimes when in us like Latino doctors. I definitely felt it, especially coming from, you know, a University of Puerto Rico where people in my residency were from, you know, Ivy League medical schools, and I felt like a huge imposter. I mispronounced every single medication because I had learned them in Spanish. So to me, it wasn't metformin, it was metformin. And, you know, having that perspective of like when you become a kind of an attending or seeing residents or med students that kind of have gone through similar things, it's reassuring, and it's nice to have, I feel like, that support with someone else.
Great, thank you both so much. Any other thoughts to contribute to this question? Okay. And obviously, like, we don't necessarily have to follow any specific order or anything. So if folks have thoughts that come up later, like, just obviously throw them out. We talked a little bit at the beginning about language and how, being able to speak to patients in Spanish is not only really helpful for information gathering, but also a way to connect. So I think actually Sophia was the one that submitted the question about, being a bilingual physician. How is that one aspect impacted your practice? In addition to the ways that we've discussed already.
I think significantly, starting with the fact that patients are definitely more forthcoming when you speak to them in their native language, be it Spanish, Arabic, whichever it is. It's always best to have somebody that can communicate with them in their own language. They're always going to be more prone to share details that they might not share with the translator or with their own family members if they're translating. But I actually have a story. It's not my story. It's from one of Elaine's co-residents from when she was at Jacobi, where it was actually during COVID. I thought it was extremely important because we didn't have family members in the ER to help us translate anything. And this resident got sign out from another resident saying that the patient had decided to be DNR, DNI. And she's like, oh, okay, you had this conversation with the patient, like they speak Spanish. Did you use a translator? And they were like, no, I just asked them tubo, no tubo. And it was like, that's not okay. That's definitely not. That's not how you get someone to be DNR, DNI. Like, that's not a proper conversation, where if you're bilingual or if, it's just you can naturally have this conversation a lot easier. And I think during COVID, it was so important to have, to be able to have somebody that could speak to patients in their own language. I mean, throughout residency and throughout my time at Jacobi, I was constantly used as the translator, and I never actually had a problem with it. I was always happy to translate because I thought it was important for patient care.
I would hugely second that. And I was actually using the exact same example of when I was in the COVID ICU toward the early days of COVID, and people would come in as a transfer and they'd be like on high flow, and they'd be like, oh, careful, like, we don't have much room to go on high flow, and she's DNI. I was like, well, okay. And I went in and talked to her about like why, what do you try to see what the reasons for why they did not want to be intubated. And they were like, oh, I told her it was a tube in my throat. And that's all they would get explained. And then it's like, oh, well, there's a little more to that. Like, and it's just being a patient advocate and being able to explain fully what, so a patient can make informed decisions rather than just being like, just blatant medical decisions that have major impacts based on limited information. So being able to really discuss fully about the medical care and giving the options to patients, it's much better for both the patients and really more satisfying for patient care. And then I'd say one thing too often I see EDs, like patients who get their pain kind of passed off because they don't, as unfortunately I feel like most Spanish speaking patients are still a little more patriarchal, and they don't like to be a bother. And so they don't, even if they're in pain, they don't like asking for pain meds unless they're literally screaming in pain. But if you actually talk to them, like, would you like it's okay to ask for pain medications? And they're like, oh, well, I guess if you have something for pain, and I'm also nauseous. Yeah. If you can keep me from vomiting, that would be nice, Si tengo un poco de náusea, pero bueno. It can just deliver, it can improve patient relationships with their attitude toward healthcare in general, not in just that encounter, but from there on out.
I mean, I think at least from in the ER, I think it's actually really important as well that you use your bilingualism to help with consults. Because I have seen consults go in and out of a room within 20 seconds and they're like, oh, they don't want the procedure. They don't want surgery. And I'm like, you were in there 20 seconds. You didn't even have time to call the translator. What are you, so going in there, being able to explain to them, this is the operation, these are the risks, even though I'm not your surgeon, I'm not your whatever. And then being like, oh, okay, sure. And then calling the consult back and being like, they're going to do the procedure now.
It's funny because I think that, I mean, there are not a lot of people in my shop that speak Spanish. And I kind of make it a note to pick up Spanish speaking patients. The reason I do that is because I just feel like even with translators, so much can be missed, right? And not only that, but then like they go through triage, and we've all seen it, right? We've seen these cases where big things have been missed because patients come complaining of one thing and really it's like another, right? It's like a stroke when they write like, oh, they just have like vomiting or like nausea. And it's like, nope, that's not like, actually they make no sense whatsoever. Like, and it's important to understand, like, yes, getting a translator is difficult. Sometimes like they don't work. Then, what if the patient doesn't like understand? Like there's so much. So I think that, just being able to speak another language is just, it's really providing better care for the patient, right? I remember I was interviewed for residency and there was another Latino attending that said that, he sometimes feels like there's such a burden on you from your Latino community because you feel like you have to be that Latino doctor. But it's like, I don't know, I've never seen it that way because I just feel like that's what I have to do, right? Like that's what my job is. And my job is to help my patients. And if my language, the fact that I am bilingual, and it's amazing that I'm bilingual because I think it's a great thing, like why not use that to the advantage of my patients? So that's it. That's my perspective.
Right. I agree. I think, like I said, that I always said okay to being a translator, but it is an emotional burden. I don't personally enjoy telling someone that they have metastatic cancer when you're not my patient or anything. But I mean, I think of, again, my parents, my uncles, my grandparents, and I would rather hear it from someone in my own language than hear it from a telephone with a translator. So you kind of take on that emotional burden, additional emotional burden.
Thank you for sharing. Yeah, those are, I think, really important things for folks to hear, especially those of us that are sort of like external to, who don't speak Spanish fluently or who, come from a different racial, ethnic background, identity, that type of thing. I think that, I think certainly for me, I like just thinking back on my own education and training, some of the perspectives that would be shared about either perceived difficulty or something like that when it came to our Latino patients, whether there was a language barrier or, like, Jessica brought up earlier, just a difference in understanding how people approach healthcare, especially if they come from another country. And it has me thinking about, I was thinking back to when I was in medical school, and we did have, one of our sort of like, it was kind of like a pillar, I think, of the medical school's like philosophy, that we needed to demonstrate cultural competency, as it was called at the time. And, I remember having sessions where it was typically with a standardized patient who was an actor playing a role, where either it was, a language issue, or it was something related to a patient's culture, that the task for the medical student who was unaware, this is a culture that they didn't understand, it was their job to try and sort of build rapport with a patient, especially if it were something that maybe didn't necessarily agree with sort of Western medical philosophy or treatment, to really try and understand, or at least try to connect with the patient and find a way to take care of them, even if there is, I guess maybe a difference in culture in terms of, how healthcare is viewed. And I'm wondering, what your thoughts are for our panelists on, having gone through medical school in different parts of the country and including Puerto Rico. Do you think that when it comes to medical students, learning about cultural competency, if I'm going to use that term, because I don't think it's necessarily the right one, but it's kind of the one that's used. Given that, a large percentage of medical schools are still white people, cisgender people, male, people that come from more privileged identities. What, I guess, I don't want this to be too loaded of a question, but I guess in your experience going through medical school, what do you think worked about that in terms of connecting with people from a different culture? And what do you think could be improved upon so that those doctors who are out there who don't speak Spanish and don't have a connection to a Latino identity, to best be able to serve patients without putting any additional emotional burden on those who are bilingual, obviously outside of a case where someone is willing to get involved and take care of patients. But I just want to know your thoughts on that.
We had a Spanish free clinic that I was a part of, and a lot of the volunteers that actually led the clinic, I would say half of them spoke Spanish, but they were either white, and then the other half didn't speak any English or any Spanish, but they wanted to just help and really get to know what the needs of the community were. And I just thought that was amazing, because I think it's rare to find people who don't feel super connected to a community, but still really want to go out of their way to show an effort. And so they would just come to the clinic and support the people that were working there and just kind of listen to the needs of the patients and then try to advocate for us. And I think it should start in medical school. I remember one of the med students at my school basically saying oh, well, you guys need to work harder on inviting white males to your SNMA and LMSA events. And I'm like, dude, I'm already burdened by being the one Latina doing the president of LMSA, volunteering every Tuesday at the Spanish free clinic. You should be wanting to come to these things. If you, I feel like people just need to make more of an effort to get to know our community, talk to us. A lot of my peers, I felt like they knew I was doing all these things and they didn't even want to ask me about it, or, it's just weird sometimes. I'm like, you guys need to I don't know, push yourselves a little bit harder to get to know, because we are the minority, and so I feel like it starts with those relationships within your colleagues, and then kind of branching out to bigger communities.
Yeah, I don't know how much I can say, because in my medical school, we were all Hispanic or Latin American, or from the Caribbean. But I do know that as I was a resident and an attending at Jacobi, I worked closely with the students at Albert Einstein. And I thought it was great that they had these organizations. They even have a course in medical school of medical Spanish, because there's such a large population in the Bronx that is only Spanish speaking. So I think it's great that medical schools are integrating this, and not just, in the Bronx, there's a very large Hispanic community, but there's also a large Bengali community. There's a large Arabic speaking community. So I think it's really, really important to get kind of a little bit of exposure to all types of cultures and learning what, if for example, we see it all the time in the ER where it's Muslim women wouldn't want a male to do a pelvic exam, and you accommodate it. And I think it's super important to have these trainings and understanding different cultures so that you can provide the best care for your patients and make them feel comfortable.
I think an important part is just stressing that these patients are just equal to any other patient they are taking care of, and in order to fully treat them as you do any other patient, you have to have some cultural background understanding of where they're coming from, what their level of education or lack thereof is in terms of they see general health issues. In Vermont, it was startling because most people thought there were no Latinos there at all. And while it is a fairly white state, there is a large community there that is Latino migrant dairy workers that are basically supporting the Vermont dairy system there, but they're extremely isolated to just the dairy farms because Burlington is only 30 miles away from the border with Canada. And so none of them were able to escape the farms. And so we had to go there. And most people didn't know that there was, great thousands of Latinos in Vermont just in hiding there. And it's difficult to try to highlight these and make other individuals care, but you have to stress that the importance that these are people just as much as in need of your attention and your healthcare, if not even more so, because they're coming from a much more limited degree of exposure to the health system.
Great. Thank you so much, everyone, for your thoughts. Let me go ahead. I'm just going to look at my question list really quick. Why don't we switch gears a little bit in the last 10 or 15 minutes that we have remaining. And let's talk about, how, and this could be related to your identity as a Latina physician or not. But Jessica had submitted a question about what keeps you motivated. I'll just say as just one piece of information, I know Jessica quite well. I've been serving as a mentor for her for a few years now. So I've had the great privilege of having a little bit of a look into, her life as a growing physician. And I'm someone who's pretty far removed from the academic clinical setting now. So, I do get to hear about things that she's involved with, advocacy work, things that she talked about before. And it sounds obviously very difficult on top of an already very rigorous clinical rotation schedule. So I guess in that way, and I'm definitely directing this mostly at Jessica, but I do want to hear everyone else's thoughts. So as someone who really works hard to advocate for the community surrounding your hospital, when you talked about, people experiencing incarceration, Latinos, other folks you're trying to advocate for, even your own colleagues. With all of that you're doing, how do you kind of stay motivated and energetic?
I feel like it's so hard because everyone asks me this all the time, and I'm like, I just feel so happy when I'm I feel like it's my mission to figure out how to fix some of these problems. And a lot of times people are like, yeah, but you're just one person. And I'm like, there's so much power that comes from within, especially when you work with other people. And so I just feel like my parents' stories always motivate me every time they share how hard it was for them to come to the United States and all their struggles. And so I feel like I see the people that I'm trying to help, I see my parents in all of them. And I'm always like, well, I can't just give up. I need to find the energy somewhere and and I think that actually doing all of those things, advocating for my residents, for example, at my hospital, I feel like that energizes me in itself, kind of seeing the outcome of what I'm doing and how I'm helping my community. And when I'm working with people who have been incarcerated in the past and they share their stories, and I'm trying to figure out how I can make medicine better for them, I feel like that energizes me. And so actually doing it is what energizes me, and it's just the cycle of energy. But it sometimes it can be hard. I know someone talked about burden earlier, and it is hard sometimes when you're just I feel like I'm the only one who's pushing really hard for all of this. And I have also learned, especially in residency, there are times where I have to say no because I just don't have the bandwidth to do some of these things. And then I still got myself in a situation where I'm like, man, I'm doing way too much right now. But it always just makes me feel so good to be if I'm going to do one thing, it's going to try to make this community better and do something about it. Cause my family is very much all you got to do something. We're not passive at all. So you're consistently doing something to make this world a better place.
I love that. I mean, I mean, I've known you for a while, and you're that like sort of energy cycle that you talk about, like, it definitely shows, because, I can tell that you really do get a lot out of doing that work and really seeing, like, I think the value. And I think also just knowing that, so many people are going to benefit from that. So I definitely appreciate everything that you do. Other folks want to comment on just even in general, like, things that keep you motivated, keeps you energized, keeps you going. I mean, emergency medicine in general, the last few years has been very difficult, just as a practice. And I'm just curious how folks are staying well and staying part of this workforce.
So I can personally say after 8.5 years in the Bronx, I decided I needed a bit of a break. And what has always motivated me and always loved to do is international work. So I kind of realized that because of COVID, there was very little international work that I could do and continue to do my shifts because of like testing and everything. I was able to like go to Navajo Nation and work there, but I always really loved doing international work. And even though it's like a break from work to do more work, you always kind of come back like reinvigorated and with more energy and being like, I really do love my job. But after 8.5 years, I was definitely very burnt out and decided to take a break, spend time with family, travel, and, explore international opportunities. So what motivates me is still kind of to be determined and still figuring it out. I do genuinely love patient interactions. Granted, of course, in the emergency room, a lot of them can be very negative, and those are very, very emotionally draining. But it's always that like one family member in the middle of a really horrible shift that comes up to you and is like, thank you so much, that, just really, really keeps me motivated.
Yeah, I'd say, especially if you're in a tough string of nights, you're on night 5 of 6, and it's just a grueling set of nights. It's just rough encounters each night. You have to take a moment before going your next shift, take reflection, think about not so much of how you're dreading about the flipping once the nights are over or whatnot, but just try to reflect on one good patient encounter you had each night, one moment where hopefully someone thanked you for your care, which hopefully happens once a shift, but doesn't always. But at least one good moment where like, oh, I changed the course of that person's care. I avoided intubation. I helped that person get home. I help, any little item that can remind you what we do every day. As tough it is, sometimes it's really important, and we do good work, but we might not always feel as much.
I think it's important to find emergency medicine for now is very draining. And I think that being an attending, sometimes I'm just like, oh my God, I just like, no more, please. But I do a lot of community work, and I think that's what sometimes drives more than actually being clinical. Don't get me wrong, I love like being clinical, but sometimes it's just like, because you're a human being, right? Everything that you interact with the patient is obviously going to take a toll on you. But sometimes like just mentoring, or actually just like going to high schools and like kind of seeing their faces, and there's not everyone's gonna like it, right? But there's always like that one student that sees something, and it's like, oh, and you look at them, and then you think about how you felt when you were a high school student and you were thinking about becoming a doctor or like going into emergency medicine. And I remember like when I knew that I wanted to do EM, and I was a college student, and like seeing them was like, oh, like I remember that, you know what I mean? Like that face of hope. So I think that has been like one of my driving forces to kind of look outside of the clinical aspects of medicine, and like through mentoring, kind of just using that as like just a way of like rejuvenation, like remembering like how it felt at the beginning, right? So that's kind of have been my drive recently.
I think I agree with Elaine. Mentorship and academics are incredibly rewarding. They can also be incredibly draining, but you know, at the end of the academic year, when you have like the residents all graduating and them coming up to you and being like, do you remember this patient? Or you taught me how to do my first chest tube. You taught me how to do my first intubation. Remember this like person or whatever story. Those are always incredibly, incredibly rewarding. And then hearing about people when they're like, oh, I had this on my first shift as an attending, and I remember you taught me this, this, and this. And those messages are always nice to hear and keep you going.
Yeah, it's true. I mean, I think that I definitely like feel like, you know, having interactions with the residents, and even like if it's after like reflecting and, you know, I mean, their youth, I feel like I'm not like sucking the life out of them, but like, it's just like, you know, you feel that like that early love with medicine, and it's like, oh, like I remember what that was. And then, you know, you have this pride also with your residents, because it's like, you know, I helped that, right? Like I created this doctor, so it's like, you know, like I'm doing something beyond clinical, right? Like it's always good to catch a STEMI, but when you're creating like a young doctor and kind of like helping them navigate these waters is also very like rewarding.
Awesome. Thank you all so much. Yeah, I think that was, you know, I think even just bringing home, like David mentioned and Sophia, I mean, really everyone had elements of this when they were speaking about, you know, thinking about those little moments of whether it was gratitude or kindness from somebody else, a patient, a family, you know, or really just like looking with pride on someone who you've helped throughout their own career and training and things like that. Like that was definitely a lesson that I probably should have learned before the pandemic hit, but it's definitely something that I think we all need to hear over and over again, is that, you know, reaffirmation through, you know, the words of others, but also I think words of affirmation that we can use for ourselves too is really, I think, pretty critical now more than ever, for sure. So I really appreciate that you all shared your perspectives on that. We do have a question from the audience. This comes from Diana Luna. Oh, and I also want to just lift up a comment from Sarah in the chat that says, woo, love working with you on shift, Dr. Rodriguez, clapping emoji. Diana is asking, do you have any advice for aspiring Latina, Latino, Latine doctors coming from an undergrad?
I would definitely say don't ever let somebody else's opinion of you kind of push you down or bring you down, because I had people in undergrad basically tell me like, why do you want to be a doctor? Like you should just be a nurse. Like I don't understand why you want to go to medical school, especially when no one in your family has done it. And I was just so appalled, like, why are you trying to ruin my dream? Like I'm working so hard. And I mean, it happened when I was as young as being in middle school, when I was like in, you know, in honors class, and I asked a question and someone was like, well, if you don't know the answer, you shouldn't be in honors class. And I'm like, what? Like, I feel like whatever it is in your heart, like if you feel like in your heart of hearts that you're supposed to be a physician, like you just keep trying and you keep finding the right people and you ask for help. Because another big thing is, don't ever be afraid to ask for help, because people might not know you're struggling or need help unless you like put it out there, and someone will know somebody who can put you in touch with somebody who will be able to help you in one way or another. Like that's how I got a free MCAT course in Miami. I was struggling, I was being stubborn and wasn't asking for help, and then finally I was like, enough, like I need help, and I got the help and I did so much better on the MCAT. So like don't let anybody else bring you down and always ask for help.
I think that's a really, really important point. I remember when I was applying to residency, one of my mentors told me, she was like, don't apply to the US. You're not going to get in. Emergency medicine is extremely competitive. And she's like, you're not going to get in. And I got into my first choice. So know how to pick your mentors. Always, I think asking for help is a huge plus, but then also taking people's advice to a certain level, you know, take your MCATs, apply with what you have, and trust that you, if it's meant for you, you'll get your dream.
I think one thing that I appreciated early on, was that somebody kind of like was very, I mean, I think that in life, if you want something bad enough, you will do it, no matter how hard it is. Medicine is not, it's not an easy career. And I think that you have to be like completely in love and there's nothing else you want to do. And, you know, there are sacrifices that have to be made. And the reason I say that is because it's going to be difficult. People will continue, no matter where you are in your career, to say you can't do something, right? Like, even as an attending, some people are like, well, I don't think that's going to be feasible. I don't think you'll be able to do that, you know, so it doesn't stop. But I think the most important thing is to also realize that it takes a village and that you have to create your own kind of like board of directors. I don't think that I would have made it where I am today without other Latinas and other Latinos helping me be where I am today. And like, for example, Sophia, like she has been a mentor to me, from like being my chief resident to even like as my first year as an attending, I used to text her at all times, like just to discuss cases. So I think that it's a realization that it takes a village and that you have to create your village to get there. And that, yeah, you have to accept, of course, like help to get there.
Yeah, I can't stress enough how important it is to have a mentor, and like especially a mentor who looks like you. Like I feel like I never had a physician in med school who looked like me, who was my mentor. Like all my mentors were white males. And I can't even like express, like Dr. Fuentes has been there for me. Like when I have hard shifts, I text her or call her. I'm like, I'm struggling. Like I need someone who looks like me in flesh to tell me I'm going to be okay. Because I feel like it adds like a whole other layer of comfort to you. And I'm like, well, like she did it, like I should be able to do it too. And so like finding someone who, you know, and I mean, you can have mentors anywhere, but like finding a mentor who you really feel like you relate to and you believe what they're telling you when you need someone to like lift you up is also like so important, especially during residency and med school, because it's tough. Like you need someone who's going to comfort you, and then you also need people who are going to be a little tough on you to like, you know, make sure you're on track. But you definitely need the people who are going to support you and be your cheerleaders.
Thank you so much, Jessica. I appreciate that a lot. All right, well, we are just 5 minutes short of the top of the hour. Any other thoughts from our panelists, any take-home points, any other questions from our audience before we close out? Okay. Well, thank you everyone so much for joining us. Thank you especially to all of our panelists for your time, for sharing your expertise, for sharing your perspectives, your stories. We really do appreciate that. Oh, it looks like Diana is asking, I would love to connect with everyone. Is it possible if I can retrieve an email as a form of contact? What I can, oh, there you go. So what I will do is, yeah, well, if folks feel comfortable putting their emails in the chat, please feel free to go and use those. And then I will also provide my email as I am kind of in charge of the whole mentorship forum project. So if you ever have questions or want to like connect with a speaker that we've had after the session, just contact me and I can definitely help you out there as well. All right, well, thank you everyone again so much for coming. For everyone else, the next session that we will have is going to be on March 23rd. So we'll be doing it 4 Thursdays of every month at 5 p.m. Pacific time. Sorry, Luis, I know you had the wrong time, but this session will be recorded and it'll be up on the AAEM JEDI website within 48 hours. So you'll be able to see that a little bit later. But yeah, please join us next month. We'll be having a session on language justice in the emergency department. If anyone wants to join us for that or even serve as a panelist, just let me know. We're definitely still looking for people to participate. And again, thank you all for being here. And this concludes our program for tonight. Great. Bye, everyone.
Bye.
Bye. Thank you.